come to order. Roll call, City Clerk.
Commissioner Abraham.
Present.
Commissioner Galt.
Present.
Commissioner Rhodes.
Here.
Commissioner Wilson.
Present.
Mayor Kaler.
Present. Tonight we have Reverend Corey Aker here with us from St. Paul Lutheran Church to do our invocation. And then we'll ask Lily Burba to come up after the invocation. She's a Paducah Tillman High School senior. She's going to help us with the pledge. Thank you, Reverend Aker.
You're quite welcome. Thank you for the honor of inviting me. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Gracious Heavenly Father, you have blessed your people with good government. Today we pray for these leaders you have raised up in Paducah. Strengthen them and guide them in your ways, that their decisions and discussions would be pleasing to you and in the best interest of the citizens of Paducah. We pray for all civil servants, that you would work through them to make, administer, judge, and uphold good laws, to protect the innocent and punish the guilty. Bless the families of our communities with your presence. Bless the honest businessmen and women of our communities with success. Bless the churches of our community, that they would never tire of spreading the hope-filled word of your gospel, the complete forgiveness of sins in Christ, to every corner of our community. Bless all participants of tonight's meeting with your guidance and wisdom, and so bless us all. Through Jesus Christ, your Son, our Lord, who lives and reigns with you and the Holy Spirit, one God, now and forever. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Thank you, Lily. Reverend Aker, thank you. Okay, I have a couple of proclamations tonight. And our first one is a proclamation for Pancreatic Cancer Awareness Month. To all to whom these presents shall come, whereas in 2013 an estimated 45,220 people will be diagnosed with pancreatic cancer in the United States, and 38,460 will die from the disease. Whereas pancreatic cancer is one of the deadliest cancers, is the fourth leading cause of cancer death in the United States, and is the only major cancer with a 5-year relative survival rate in the single digits at just 6%. And whereas when symptoms of pancreatic cancer present themselves, it is in the late stage, and 73% of pancreatic cancer patients die within the first year of their diagnosis, while 94% of the pancreatic cancer patients die within the first 5 years. And whereas approximately 450 deaths will occur in Kentucky in 2013. Whereas the incidence and death rate for pancreatic cancer are increasing, and pancreatic cancer is anticipated to move from the fourth to the second leading cause of cancer death in the U.S. by 2020. Whereas the U.S. Congress passed the I'm sorry, I can't pronounce that word.
That's a word I can't pronounce either.
Can you pronounce that word? Recalcitrant. Thank you. Cancer Research Act last year, which calls on the National Cancer Institute to develop scientific frameworks or strategic plans for pancreatic cancer and other deadly cancers, which will help provide the strategic direction and guidance needed to make true progress against these diseases. The Pancreatic Cancer Action Network is the national organization serving the pancreatic cancer community in Paducah, Kentucky, and nationwide through a comprehensive approach that includes public policy, research funding, patient services, and public awareness and education. Whereas the good health and well-being of the residents of Paducah, Kentucky are enhanced as a direct result of increased awareness about pancreatic cancer and research into early detection, causes, and effective treatment. Now, therefore, I, Gail Kaler, Mayor of the City of Paducah, Kentucky, do hereby proclaim the month of November 2013 as Pancreatic Cancer Awareness Month. And there is a vigil at Whitehaven. I believe it's next Saturday. Or is it Saturday or Sunday?
I think it's Sunday.
Sunday the 27th. So anyone that's interested in coming out that night, they will do the purple lights, I believe, in the sky. And we'll read the proclamation again there. Another proclamation tonight is for working women. To all to whom these presents shall come, whereas working women constitute 71 million of the nation's workforce and strive to serve their communities, their states, their nation, in professional, civic, and cultural capacities. Whereas women-owned businesses account for 30% of all U.S. business, generating 1.9 trillion in sales and employing 9.2 million people. Whereas the major goal of business and professional women's foundations are to promote equality for all women and to help create better conditions for working women through the study of social, educational, economic, and political aspects of our country. Whereas all of us are proud of women's leadership in many fields. Whereas the Paducah Business and Professional Women's Organization, Inc. is the oldest Commonwealth of Kentucky, having been formed in 1990 by Ms. Ann L. Baker. Now, therefore, I, Gail Kaler, Mayor of Paducah, Kentucky, by the authority vested in me, do hereby proclaim October 21st through the 25th National Business Women's Week. The event is sponsored by Business and Professional Women's Foundations. I urge all people in Paducah, Kentucky, all civic and fraternal groups, all educational associations, all news media, and other community organizations to join their salute to working women. Encourage and promote the celebration and achievements of all business and professional women as they continue to contribute daily to our economic, civic, and cultural purposes. In witness whereof I have hereunto sent my hand, and caused the seal of the city to be affixed on this date, 10/22/13. And Merriman, are you part of the group that's going to take this tonight? Do you all want to come up and say anything?
We don't have anything to say.
Okay.
It's quite apparent, looking at our leaders, that we are well represented.
Might be a majority.
Oh,
Let's get over here where she can get a good photo.
okay.
You're so tall.
I know.
Thank you.
Thank you.
Miss Kemp,
Yes.
where are you from?
Your hometown.
I thought so. I thought so.
Not far from here.
Not far from here. Yeah, Newbern. Yes.
Okay. We have a couple of presentations tonight. We have Julie Harris tonight with the Dragon Boat Festival update.
Go too fast, hit the left one. Oh, okay. I've got a little PowerPoint, so thought that might make it nicer to have a visual. So I just wanted you all to see, for those that weren't there or a part of it, about our great day. So this is our second year. We have this beautiful river, the confluence of the two rivers, and we aren't down there enough. So we needed an event that would bring people to the river, but also connect them to the river. So, of course, we do that at the River Discovery Center every day, but when you physically connect with it, it's a whole different thing. So, in its second year, we had over 7,500 people at the riverfront. 32 teams participated. It offered teams a chance to be on the water, as well as raising money for the educational programs of the River Discovery Center. Last year we estimated the numbers. We didn't know what to expect, and so this year we actually did actual counts. And so that's a fairly accurate number, and pretty amazing. In its second year, we raised over $90,000 to help grow our educational programs. So we're thrilled with that, and can't wait to continue it. It'll be a great annual event. So, okay, we've got some pictures here to take us through. There is Team Paducah, hits a home run for breast cancer. We were so glad to have the city participating for such a great cause, too. And so not only does it help us, but it's a great way to raise breast cancer awareness. And we were glad that after last year's Kentucky Thoroughbreds team coming in from Cincinnati that you worked so hard, Mayor, to put together a team for the same purpose of raising that awareness. Here, Commissioner Abraham was there to sing our national anthem, so much better than us just playing it, to hear his wonderful voice, so thank you. That's a nice shot of our drummers dress up. So that's what this was, one of our team drummers. There's another team drummer. We had some great food vendors. That is the tent area for the MSI Taiwan On team, and they had a Mardi Gras theme, and they actually won the best team area. So it's lots of fun. They all have a good time with that. We had all of our rescue boats from Coast Guard to the McCracken Rescue Squad, the Sheriff's Department Rescue Squad, and then Ingram Barge also had a boat. So they're very critical to providing safety at the event. And, of course, this year we once again had a capsize, so they play an important role. So these are just more shots of the event. A little one cheering on his daddy. That's a drummer. This was a part of our drummer fashion show we have during our lunch break. So that's the lineup area. And there's Mayor Kaler giving a high five to one of the team members. Oh, okay. I couldn't tell. That's the MSI team. That's the drummer from the Rock and Rowers team, which was Ingram Barge, and she was dressed as Gene Simmons and won Best Dressed Drummer. So she, I think, really got into that part. So this was our results board, which was a very popular place all day. There's the Kentucky Thoroughbreds team that actually has pink paddles. And they come in from Cincinnati, which is really great to have them come such a distance. The Murray State team, for the second year in a row, won the event. So here they are posing after, that's probably after their second race. That's somebody in some festive attire, and there's some kids having funnel cakes, a little one watching the races. This was great. This was the community college team, and they had a great entrance, and so this was they were singing and carrying somebody on a throne. It was lots of fun. That's Terry McKee with Key Force, and they actually, their team, NIT to Win IT, won second place, and it was their first year, so that was great for them. And this was basically loading up the boats at the end, how they're loaded out of the water and pulled out and sent back to Canada. Save the date. We've got our date, September 20th, 2014. So, and I want to present to you Team Paducah's picture.
Thank you, Julie. Well, we had a great time, and it was such a good team builder for the city, and we had a few civilians in there too,
Well, that's
to round out the team, and Commissioner Galt.
I know. I was glad that we had Commissioner Galt, Commissioner Abraham participated. I know a few of you were down there. I know
Sandra was there
Sandra's,
to cheer us on.
yes. So we were thrilled to have you all a part of it this year.
It was
so.
a
Great event.
And we really want to work next year to have a breast cancer survivor team, the survivors that actually do the paddling. So we're working on that right now, and Julie's been very helpful with giving us some ideas on some things that we can do. We raised about $700 above paying for the boat and paying for all of the shirts. And we're going to donate that to Relay for Life.
Which I think is wonderful. I love that, there's one of the beautiful things about this event is that it not only raises money for our cause, but that we can, other organizations can benefit as well. And, the numbers of companies that participate in this, and it's such a great team building event. I think what our evaluations that have been coming back to us say is they love that individuals from all different departments can come together, and so that's one of my favorite things about the event itself.
And it's just really fun being in the river, isn't it, Carol?
It was a lot of fun, and you get to see Paducah from a different viewpoint, if you will. But Julie, I just want to commend you. You ran a great event. It was very well run. We always knew what to do. We knew where to be. We knew who to contact for what, and there wasn't any confusion. It was
Well, good.
very well done.
Thank you. Well, we work hard, and we want to make it go as seamlessly as possible. And I also want to say thank you to the city and the departments that really step up and help us too. It's a group effort, and police department was wonderful. Parks and making the riverfront a beautiful place to have an event. So it's just great that we have something down there.
I wanted to add that it's another example of when you have quality events in our downtown, people will come. So, and the people you saw there, the businesses downtown, some of the restaurants, had a great day. So it just further solidifies to me that the event coordinating is huge. It will take care of a couple other things if we get that right.
Well, and since the event, several businesses have told me how they had another great year, and I certainly hate to the possibility of negatively impacting any business downtown, and so it's always refreshing to know that they all benefited from it, all the people as well. So we was very excited about that.
Thank you.
Thank you.
Okay, we'll go on to our appointment. Oh, sorry. Health insurance. Greg, welcome.
Good evening, everyone.
Have some pretty good news for us?
We do.
Good.
Very good news. So I'd like to share with you, good evening to all of you. I want to share with you a briefing that encapsulates a conversation we had with the larger committee and after several management meetings about planning out the 2014 briefing. So we're going to condense this, but the good news is that the recommendation you're going to hear tonight is that once again we'll be able to hold our rates and allocations for the new year. We've been successful in bringing together a combination of programs and risk management systems for 2014 that the underwriters feel and the actuaries feel very good about partnering with the city and the city's employees. One of the things we also want to realize is that this plan is the employees' plan. It's theirs and their children and their spouses' program. It may be sponsored by the city, but the members really make up the program itself, and they ultimately own that program
and how well it turns out each year. So their ability to connect with it, to use it wisely, also affects the outcomes beyond what we're able to do to lead and guide that through each year. So what I thought I'd do, again, we'll condense this, but this is the full breadth of what was discussed last week in the briefing we gave to the committee, including the collective bargaining groups. And so we'll talk about some history, a financial update, talk about something we see on the radar we want to address in 2014 under the chronic condition summary, and then we'll give you some recommendations, and we'll answer questions for you this evening. So just in terms of history, this is the slide we saw last year. I've added on the right-hand side the 13th year of this. So it goes back to 2001, and it follows through all the way through for the years that we've been tracking these claims. At the top, you see red and blue. The red are medical claims with the blue headers, toppers there are the prescription drug claims. And there are two rows there. We saw this last year. $2 million is a magic number and $3 million is a magic number, only because when you stop and think about it, what if we just wrote checks for the claims, we had those negotiated with the doctors and hospitals, we didn't have to have insurance, we didn't have to pay someone to actually do the administrative work. The top bars would basically represent what that would have looked like financially. So without any insurance involved at all, we would have been out somewhere around $2 million, just shy of $2 million, as much as over $3 million, sometimes as much as $3.8 million. But we do buy reinsurance for the purpose of helping us to lower our overall risk and the risk of the members. So at the bottom, the blue basically subtracts out any money we receive from the reinsurance agreements, and it shows dramatically how we're able to reduce that liability for the city and the members. And even when we have a bad year, that it really softens that blow. The most right side of this is the 2013 year as projected through the end of the year. So you can tell we're having another relatively good year, knock on wood, if things continue the last 3 months like they have the first 8. And so the last year, 2012, as you can see, was an abnormally large year. If you back up several years, about 5 years prior, you see another larger year, then another. So it's really from left to right, fair, kind of poor, fair, poor, then gets a lot better, then it gets poor again. So that's not uncommon in health plans. So we want to look at these on the longer term. And if you notice on the bottom chart, I've drawn a line there. It's black, sort of hard to see, but it rises right up through the $2 million mark and it slopes downward. The City of Paducah's employee benefit program for health care and drugs actually is going down on a per member per month basis for the last 13 years, which accounts for how we've been able to, the last 5 or 6 years, been able to reasonably keep things the same. Same plan, same rates, same contribution strategy with a few minor alterations. So in terms of reviews, I want to share with you the 11, 12, and then through August of 13 quickly. And at the top, we're seeing the City of Paducah sort of just as a whole for the employees here. So you can tell their employees, the members were serving well over 530 men, women, and children on the program. This year, on the far right there, you see paid claims. We've paid $1,149,000 out through August. We've had administration and reinsurance. So again, it's back to insuring the plan and having it administered. Then some dollars spent for HSAs, flexible spending dollars, and then total employer net expense of about $1.2 million. At the bottom, what we've done there is we've said, well, but JSA contributes to this as well. They have their employees in the program, so they're actually contributing their dollars. We're also showing those stop loss reimbursements. That's money from the reinsurers. So notice that in red in 2011 and 12. 2011, we received almost $300,000 back from insurers. In 2012, it was $1.2 million. So again, that helps to subsidize the bottom line cost. And so the total adjusted city expense, $2,012,000, $2,243,000 in 2012, and then this year through August, $1,132,000. So we're expecting the 2013 cost to be again back in the $2 million to $2.1 million range. So very, very consistent within the last 3 years. What we do see, though, is that a significant portion of the city's risk is coming from chronic disease. So disease that stems from diabetes, high cholesterol, and hypertension. So I'll show you this diagram to share really 3 things. The diabetics on the upper left, the hypertensives on the upper right, and the high cholesterol is in the middle there in the bottom. Where these 3 circles intersect, you see that these are people that have more than one condition. So starting from the center and working out, 17 of the 143 in 2012, again, we don't know who these people are. We're not focused on who they are at this point, just that they're in the mix. 17 have all three conditions. 36 on the right there, you see in the middle, have both high cholesterol and high blood pressure. On the left, 1 has diabetes and high cholesterol, and then 8 have high blood pressure and diabetes. And then you see in the yellow, those are actually just folks that have one of those conditions. Well, why is this important? Because those individuals represent a substantial amount of the total cost. And so what we're showing you here is that all members cost per member per year. On the right, if you took out the members, and we could help those members control their diseases better, control their amounts they have to spend on those, so get healthier, then that would show you how much that reduction is. And then in the middle, these are the members with the chronic disease. So we're spending almost $12,000 a year on average for each person that has these chronic diseases, compared to less than $6,000 a year for people that are chronic disease free. Okay? So we want to focus our attention on those and help those individuals to become good, solid consumers of care, to get the right care at the right place and time. And we also look at things like compliance. So when our doctor says you should get this test or you should have this follow-up treatment, is that happening? And I can tell you that some of the time it's happening, but most of the time it's not. For some reason, some of these folks with these chronic illnesses are not either able or willing to follow through with their care and treatment. And I suspect part of it is because once we get on a medicine or we start feeling a little better, we've been seen by a doctor, we sort of say, well, now that I feel better, I don't know that I need to go back. But it's very important with these kinds of diseases that they follow up, because these can be life-threatening and debilitating diseases. To sort of further illustrate that, we've looked at these in terms of chronic diseases at the top there in red versus all others. And you can see how those diseases rise way above just the entire average. And to further illustrate that, if we separate it into 3 points, those with chronic disease, the average of everyone in the middle in the red there, and then the blue would be if you could strip out the chronic disease. And again, I'm not suggesting we would get rid of someone with chronic disease. What we want to do is help them improve their overall quality of care, quality of life, and thereby improve the overall cost. So to summarize these chronic versus non-chronic, we said let's take every claim out of the system that has over $100,000 or as an entire amount. We have 598 in 2012 served throughout the entire year. 112 of those people were served in one of these chronic conditions for that particular period that we're looking here. That was July of 11 through 12 of 12. So per member per year, on average, we're spending $3,000 for everybody, but we spend $5,700 for those chronics. We spent $1.7 million on everybody during that period, but $640,000 for those smaller number of people. So if we could just simply move folks that have chronic illnesses to even within 50% of what the average spends, we'd save over $140,000. We think that number's legitimate. We think we can probably even get further down over the course of 2 or 3 years and actually save more dollars, but more importantly, save more lives in the long term. Because these are diseases that are causing heart attacks and strokes, and they're causing amputations and other kinds of problems with the diabetics. So I wanted to throw that out to let you know that's a recommendation we're going to follow up with in the near future with you about chronic disease management, so you'd be briefed on it. So in terms of this year and finishing out this year, again, to reiterate, we're seeing the bottom line be within about 2 to 3% of what our projections were last year. One of the things that I want to caution against is that the health care law that's passed will end up costing us somewhere between $35,000 and $100,000 of additional dollars in 2014, depending on taxes, fees, the number of members we have, and the kinds of claims that have to be paid at a minimum. So even if we did nothing else but repeat 2013 and then add on the additional taxes, fees, and other parts of the law that are going to be implemented in 2014, we need to come up with an additional nearly $100,000. You see, this year we're expected to end somewhere probably within $80,000 of our budget and be actually under budget. That $80,000 is going to go away very quickly come January 1 as we start paying these additional costs. And those aren't helping anyone. It just passes straight through to the federal government. From an underwriting review, again, on the left-hand side, just to remind the commission, we have a $150,000 deductible on each covered member. Anything over that goes and gets repaid by the reinsurer. Currently, you can sort of see on the left there what our numbers are in terms of expected costs. So we're, again, ranging in that $2 million plus range. The original renewal called for well in excess of 27%. We were very startled by that because we'd had such a good year. But when you look at the last 2 years, because of that blip we saw earlier, the underwriters are being overly cautious. We came back and acknowledged the fact that last year and part of this year is being driven by these chronic diseases, and we would bring in a care management plan. The underwriters responded favorably and initially said, that's fine, we'll save 14% if you'll institute some type of a risk management plan around these chronic care groups. So we'll reduce that 20+% down to 13. Then we went back and said, well, what if we also took a little bit of the risk? So instead of a $150,000 deductible, what if we took a $175,000, we took some of this risk? How much more would that help us? And you'll see there, I've circled the far right side, that second from the right side column. That actually reduces our overall exposure to a negative 1.17%. So we moved from over 25% increase in cost down to a small negative number. So basically a wash, if you will, for this year by making a few changes, one of which is we're going to need to spend some dollars. I've already put those in the budget, between $40,000 and $50,000 to create a nursing program, basically a chronic care nursing program that will be done here either on-site or near-site or a combination. So it'll be more concierge care for those people with chronic diseases, to streamline and improve our wellness program so that there's something in the wellness program for everyone, not just those that want to embrace wellness wholeheartedly, but those that say, I would love to do that, but I'm just not at a place with my health where I can. So now there'll be an option for those people to move themselves closer to a place of being well. And so the escrow and budget for this year, we're looking at two things we always look at every year is what we think things will cost actuarially, that's called expected, and then likewise, what would happen if we have another just horrible, horrible year. So on the left, expected, we believe next year we'll see claims in the $2.2 to $2.3 million range. We always budget in case we want to stop the plan at the end of the year and just go somewhere else. We always have money in the bank. We want to have money in the local bank to be able to pay those final claims, keep everybody whole. We know it'll cost us about $500,000 to actually buy the insurance for the program. So most of the cost is claims, but we do buy this reinsurance. Right now we have $1,089,000. I say right now, as of a couple weeks ago, there was $1,089,000 in the account. So the way this works is the city, through its allocations, puts money in the bank. Money comes out there for claims and other expenses, and then what's left over mounts up over time. We've been successfully able to run this program and accumulate a little over $1 million. We theoretically need about $750,000, so that leaves us some money to subsidize the cost this year. So by doing that, we come back in with basically a zero change for the members or the city. On the right-hand side, though, what happens if we have a bad year? Well, the bottom line is we probably will be short about $570,000 to $600,000. Remember, though, we've got a budget of $750,000 to leave in the escrow, so we should still have enough to wash ourselves of that program and still come out barely on top if we were to hit a maximum year next year. So I think this budget does both. It allows us to meet our expected goals and retain a nice escrow. If we have a bad year, then we'll have to start rebuilding the escrow. I don't expect that we'll have a maximum, but it can happen. So we always have to acknowledge that. And so historically, allocation-wise back to 2009, the city's put about $8,500 into the hands of members to choose and let them decide which plan is best for them. Out of that, they've been able to also earn up to $1,900 worth of wellness credits. And then we've subtracted from that the cost of the average in this HSA-style premium. So those didn't change for 4 years. We changed them last year. The net available, these are extra dollars that are left over. So if we just did the math and said, I'm going to give you the allocation, I'm going to give you some wellness credits if you've earned it, we're going to subtract out what you owe. That's left members with about $1,500, almost $1,600 left to spend in their HSA account. In 2013, the number was about $1,252. Our suggestion for 14 is to leave that allocation the same, we're going to have, they've already earned their wellness credit if they've participated all year long, so we really can't take that away for 14. We want to revamp that program, but that will be for 15. The investor premium, leave it alone. So again, no change to the allocation, no change to the cost for the members, and I think this will be welcome information that they'll be receiving. They're hearing horror stories about what's happening with health care today, so I believe they will appreciate that. As an example of some of the horror stories, we also looked at the Kentucky Employers Health Plan. They released their rates a couple of months ago. They lost their grandfather status. They changed all the plans and rates. They threw 4 plans out, added 4 new plans. If we went into this program, it would be March and before we could even go in. And if we go in, we'd have to stay for 3 years before we could get out. And if we got out, we'd have to stay out for 3 years. And just to kind of illustrate what would happen here, every one of these red blocks that you see is where the city would be expected to match the state's funding on a very, very expensive plan that they have in all of these 4 plans. So whether it's a non-smoker or smoker rate, the majority of those plans will require the city to spend more money, would also require the employees to spend more money. So where today the employees in 3 of these plans that we have at the city actually don't cost them anything, they get money back, assuming they've earned their wellness credits, every plan the state has to offer would end up costing the employees of the city money. So when we look at that overall, it's hundreds of thousands of dollars that would be going to the state out of the city's pocket and out of the employee's pocket. I can't make any finance work to move to the state at this point, nor a recommendation to do that. So the other programs we have, there are no dental plan rates or cost or benefit changes, no vision plan or cost changes. The Health and Human Services and IRS are making changes to the way waivers work. So what they call freestanding HRAs. So we're going to have to address that in the next few weeks. We want you to know about it. It's nothing the city or the management has done to try to affect those waivers, but it's something coming from the federal government. So we're looking at that. There's more legal meetings this week. On Thursday, after that, we'll know more about what is permissible. No change to AFLAC, online systems. Wellness, again, we'll be doing more upgrades to wellness. And then Edumedics is a name we will probably start to hear quickly, and that is a firm that we've worked with the city over the last few months to create this care management program, and we're going to recommend that we adopt an Edumedics program for next year. So our recommendations are that we hold our existing rates and allocations. We monitor the claims and the escrow all throughout. We do this every month with the city here on site. We implement this contract with Edumedics, which you'll hear more about in the next few weeks, to create a care management plan, a total care management for the chronic disease. Streamline our wellness program and its credits for 2015, make sure it's compliant with the new health law, redesign our plans and rates in wellness to make sure they're all in conformity with the Affordable Care Act for 2015, and then we build on our communication strategy early in 14 to help the members stay prepared to understand what's coming so they don't feel like they're caught off guard by the end of 2014. So I know we ran through a lot of things. I'd like taking questions that you have. And just want you to feel comfortable that there are lots of eyes and hands on this project, and I feel like it's moving in the right direction. It's come a long way from where it was back in 1998 when we got involved, and I feel very comfortable with where we are today. And thank you for your support.
Questions?
Good job, man. The way you laid this out, showing before you started, you talked about how it's the employees' package. It's their program, and so when you point out and you show specific areas where that program is being stressed, it goes back to the employees, and I fully support that type of approach. It's your program, so the healthier you get, the healthier the program is. And I think that's an approach where everybody can, even though they're at the different parts of their wellness journey, can all agree that that's the way it should be. So I applaud you for that. That's a nice approach.
The HSA account, does that, if they have money left in it 1 year, does that roll over to the next year? So that's theirs to keep in a health savings account?
Yes. So there's an incentive there to be a good consumer and keep what you don't need and roll it to the next year, earn interest on it, tax-free.
I just commend you for the good work you've done on this plan this year and for keeping it at the same level of contributions from the employees. And doesn't sound like it'll be quite as good next year, but I'm sure that you'll work hard on that as well.
I would like to echo that, Mayor. We just couldn't ask for a better advisor. Greg Carlton works extremely hard for us. We do meet monthly. I'd also like to thank other members of the monthly management team that meets on the issue. Of course, Jeff and John Perkins, Audra Herndon. So HR and Finance works very closely together, and we stay in contact monthly. One of the things that is pretty evident as we meet monthly and Greg navigates us through this extremely complex issue is the city's been on a good path, and we are well prepared, better prepared than I would say other cities our size or other accounts our size. We've made decisions like going to self-insured before it was cool to be self-insured. Our commitment to wellness is firm and it's strong, and kudos for us for having been on the front end of that kind of a decision. Maintaining our grandfather status back in 2010, all of those decisions that we've made along the way through Greg's advice have really teed us up to be in the most flexible spot that we can be in as we look at risk financing this whole complex issue.
Okay. Thank you.
Thank you.
Thank you.
Okay, Commissioner Abraham, please, for the minutes.
I move that the reading of the minutes for October 15, 2013 City Commission meeting be waived, and that the minutes of said meetings prepared by the city clerk be approved as written.
Second.
Has everyone had a chance to look at the minutes?
Yes. Yes.
City Clerk?
Commissioner Abraham,
Aye.
Commissioner Galt,
Aye.
Commissioner Rhodes,
Aye.
Commissioner Wilson,
Aye.
Mayor Kaler.
Aye. Okay, under appointments, whereas subject to the approval of the Board of Commissioners, I hereby appoint Carla Berry to replace Joe Dempsey, who has resigned as a member of the Paducah Riverfront Development Authority, which term will expire October 28, 2015.
I move that the Board of Commissioners approve the action of Mayor It does. Mayor Kaler in appointing Carla Berry as a member of the Paducah Riverfront Development Authority.
No way.
Huh?
Are you finished?
Yeah, go ahead.
I am.
Second.
I'm glad that bit somebody else. I got bit twice. Thank you.
Okay, well, any discussion? Does everybody know Carla?
Great addition.
Yes.
Yeah.
Yes.
She'll be good on the board, and she's excited. And they're certainly vested in the downtown now with their renovation of the old Hank Brothers building. So, right, City Clerk?
Commissioner Abraham,
Aye.
Commissioner Galt,
Aye.
Commissioner Rhodes,
Aye.
Commissioner Wilson,
Aye.
Mayor Kaler.
Aye. On to motions. Commissioner Rhodes, please.
I move the following documents be received and filed. Documents, insurance certificates, Ivets Plumbing Contractors Incorporated, Brookshire Concrete Construction, agreements and contracts, license agreement with Paducah and Louisville Railway for permission and license to use the corner of Martin Luther King Drive and North 9th Street located in Paducah, Kentucky, an agreement to employ Brandon Barnhill as Paducah Police Chief.
Second.
City Clerk?
Commissioner Abraham,
Aye.
Commissioner Galt,
Aye.
Commissioner Rhodes,
Aye.
Commissioner Wilson,
Aye.
Mayor Kaler.
Aye. Under municipal orders, Commissioner Wilson, please.
I move that a municipal order entitled, "A Municipal Order Approving and Adopting the Comprehensive Health Insurance Benefit Plan Premiums for Calendar Year 2014, including premiums for optional dental and vision care for employees of the City of Paducah," be adopted.
Second.
Okay, Cindy?
Okay, before you, this is one of the easier ones, right? When you do all of the work and the strategic planning and the risk financing, and you can say, here we are able to hold premiums flat. That's a fairly easy conversation today.
Okay. Good work. City Clerk, please.
Commissioner Abraham,
Aye.
Commissioner Galt,
Aye.
Commissioner Rhodes,
Aye.
Commissioner Wilson,
Aye.
Mayor Kayler.
Aye. Ordinances, adoption. Commissioner Abraham, please.
I move that the Board of Commissioners adopt an ordinance entitled, an ordinance authorizing the mayor to execute a contract with Convention Center Corporation for specific services. This ordinance is summarized as follows. That the mayor is hereby authorized to execute a contract with the Convention Center Corporation in the amount of $100,000 to be paid in quarterly installments. First quarter, $34,500 less insurance premiums. Second, third, fourth quarters, $21,833.33 each, to market and operate the Expo and Julian Carroll Convention Center. This contract shall expire June 30th, 2014.
Second.
Okay, any discussion? And this has gone down some. City Manager.
It has, over the past 3 years, from a high, I believe, what would be 3 budget years ago of $175,000 annually at that time.
It'll go down some more.
Okay.
We hope so.
Yeah.
City Clerk.
Commissioner Abraham,
Aye.
Commissioner Galt,
Aye.
Commissioner Rhodes,
Aye.
Commissioner Wilson,
Aye.
Mayor Kayler.
Aye. Ordinances, introduction, and we do not vote on these. Commissioner Galt, please.
I move that the Board of Commissioners introduce an ordinance entitled, an ordinance authorizing the mayor to execute an agreement between the City of Paducah and Anthem Blue Cross Blue Shield. This ordinance is summarized as follows. The mayor is hereby authorized to execute an agreement between the City of Paducah and Anthem Blue Cross Blue Shield as the city's third-party administrator to provide claims administrative services related to the city's health insurance plan. The effective date of this agreement is January 1st, 2014, and ending December 31st, 2014.
Second.
Okay, the two documents coming before you for introduction tonight. This first one, we separate out the administrative services agreement. This is our administrative services agreement with Anthem that we agree that they administer our claims as our third-party administrator.
Okay. Everybody okay with this?
Yes.
All right. Commissioner Rhodes, please.
All right. I move that the Board of Commissioners introduce an ordinance entitled, an ordinance accepting the rates for stop-loss insurance coverage with Anthem Blue Cross Blue Shield for the group health insurance plan for the City of Paducah, Kentucky for the 2013 calendar year and authorizing the mayor to execute contract for same. This ordinance is summarized as follows, that the City of Paducah accepts the rates offered through Anthem Blue Cross Blue Shield for stop-loss insurance coverage for the group health insurance plan for the City of Paducah, Kentucky, effective January 1st, 2014. The stop-loss rates are as follows. Individual stop-loss, $175,000 maximum city liability per person with monthly cost of $92.98 per member, and aggregate stop-loss of $3,391,721.04, maximum city liability of total claims combined with a monthly cost of $6.29 per member. Further, the mayor is hereby authorized to execute a contract with Anthem Blue Cross Blue Shield for stop-loss coverage.
Second.
Okay, Cindy.
And as you can see, there are a few more moving pieces in this agreement with the stop-loss agreement. These are some of the numbers that Greg was talking about as far as our maximum liability. That is set, raising our stop-loss, our reinsurance rate from $150,000 to $175,000, just risk financing that a little bit differently for next year.
I think it bears mentioning, too, Greg, expound on this if you care to, but the inclusion of the Edumatic program favorably impacted these rate negotiations.
Yes, absolutely. I do not think that fee for Edumatics is in this document. It was in the budget we showed you earlier, and we'll bring that under a separate recommendation for acceptance of a contract. Edumatics is a Louisville-based firm that actually is developing talent here in Paducah to service a variety number of clients, including the city, should the city move forward, for developing this care management chronic disease program, which would be more concierge in style. So those numbers, again, we expect to be somewhere between $40,000 and $50,000 the first year contract cost. They will be presented to you in the near future along with a more formal presentation from Edumedics.
Greg, is it correct to say that the discounts that we received for implementing an Edumedics type strategy for 2014 are included in these numbers?
Yes, I'd say 13% of $3 million, so well over $375,000 is a consideration of removing costs from the city in order to free up some dollars that you could spend on a program to put in a chronic care management program. Those are in there. The savings is there, the expense is not.
Now, will they work like a concierge with individual
Yes.
folks in
This will
the...
be totally confidential, and we'll start out with an opt-out program, most likely, where they'll receive a general letter. Everyone would receive a general letter about what the program entails. Specific individuals would receive their own care management invitation, and then that individual would be enabled to then say, I'd rather not participate, or I want to participate. And then they'll be given options of how to connect with a nurse practitioner.
Okay. Thank you. Okay, Commissioner Wilson, please.
I move that the Board of Commissioners introduce an ordinance entitled, An Ordinance Abolishing Chapter 6 Alcoholic Beverages and Establishing a New Chapter 6 Alcoholic Beverages of the Code of Ordinance of the City of Paducah, Kentucky. This ordinance is summarized as follows. This ordinance abolishes Chapter 6, Article 1, Section 161 through Section 69, and Chapter 6, Article 2, Section 631 through Section 640, and establishes a new Chapter 6, Article 1, Section 61 through Section 69, and Chapter 6, Article 2, Section 631 through Section 643, which is known as the Alcoholic Beverages Control Chapter of the Code of Ordinance of the City of Paducah, Kentucky. This purpose of this ordinance is to bring the City of Paducah's alcoholic beverage ordinance into conformity with new revisions to Kentucky's alcoholic beverage statutes, KRS Chapter 241 through KRS Chapter 244. Further, this ordinance establishes penalties for failing to renew licenses within the time prescribed by the notice given by the Department of Alcoholic Beverage Control pursuant to KRS 243.090. These penalties and/or fines are published as follows in accordance with Kentucky Revised Statutes. Section 6-37 Renewal. A. Renewal license shall be issued under this chapter in the same manner as original licenses, see Section 6-33, with respect as to application therefor, standards for same, and the execution of the required bond. B. Penalties. 1. Any licensee who fails to file for renewal or pay the license fees on or before the time prescribed in the notice to renew from the state's Department of Alcoholic Beverage Control shall be subject to a penalty in amount equal to 5% of the license taxes due for each calendar month or fraction thereof. Provided, however, the total penalty levied pursuant to this subsection shall not exceed 25% of the total license fees due, nor shall it be less than $25. 2. In addition to the penalty described above, the licensee shall also pay, as part of the license fees, an amount equal to 12% per annum simple interest or any unpaid license fees which were due until the license fees are finally paid to the city. A fraction of a month is counted as an entire month. 3. Every license fee imposed under this article, together with any penalties and interest which are assessed in relation thereto, shall become a personal debt of the person who is liable for same as defined under this article, from and after the date that the license fees were to be paid to the city. The city shall have the right to enforce the collection of the license fees and all related penalties and interest by civil action in a court of competent jurisdiction. To the extent authorized by law, the city shall be entitled to recover all court costs and reasonable attorney fees incurred by it in enforcing any provision of this article.
Second.
Okay, so we're abolishing some of our wording to make it more compliant with the new state.
I think it's essentially all.
It's just to put us where we should be with the state's changes.
Yes, that's correct.
And if you're really curious what the differences are, just go to the state Senate Bill 13, and it even is highlighted in yellow the changes, if you want to get real technical.
If you want to know.
And Tammy, do you have any comments on it because you are the ABC person for the city of Paducah? Do you think it's the change makes it a little more simple, clear?
It's supposed to make it more simple. They've gone from 88 licensed to 44 through the state. They have merged several licenses. They've divided. Well, they've always had the quota and the non-quota license divided, but now those are divided by name. So you have non-quota one license, which are like your horse track license, convention center. You have non-quota 2 license, which is your restaurant, your hotel and motel license, and you have non-quota 3 and non-quota 4. Those are our other license. And then you have just your quota licenses, which is your quota package and your quota retail by the drink license. And then your third choice is malt beverage. So it has made things simpler, I think, to that degree. It will make it, I think, more user-friendly for the applicants and the licensees as we go forward with this.
Well, that's always good.
It is good.
Yeah.
Tammy didn't stumble at all, did she? She knows exactly what she's talking about.
I know it.
I don't know about that.
That's why she's the clerk.
That's right.
And that's why she's the alcoholic beverage
Beverage.
administrator designee.
And will you be taking your oath soon? Like, do you like put your hand on a bottle of whiskey or something to take your oath?
No, I only get to do that one time,
Oh, okay.
and then I drink it. No, I'm just kidding. Just kidding.
You don't do that. Oh,
No.
I didn't think.
So you're not going to make a tour of
I
all
don't
the
drink.
all,
Let's don't get that
all the
started.
packaged
But
liquor stores
don't ask
and
me. I
bars?
don't drink.
Okay.
All right, city manager's report.
Well, I think, first of all, obviously a wonderful weekend in Paducah, all the activity in the downtown area and the events, and I want to recognize all the city departments that were involved in the assistance with the staging of the concert in particular, but also more in general, a lot of the maintenance work and preparation for all of the activity in the downtown area. As well, of course, as the event organizers over the weekend, Independence Bank in particular with the concert. From all indications, including that of Parks and Rec Director Mark Thompson, everything went off seamlessly, and even the weather cooperated, although it did get a bit chilly towards the end of the evening. Tomorrow, the PRDA meets for the first time to take up the review of the Riverfront Development Project. So that is obviously a very substantive piece of work that's before PRDA, and I'm confident that that body is going to proceed with a lot of resourcefulness and dedication to finding solutions to the project. The three committees that were spawned from the citizens survey, that being neighborhood revitalization, civic engagement, and the city's role in economic development, have now all met at least once. I know at least one of those is meeting for a second time tomorrow. And from all indications, the initial meetings were very robust, produced a lot of thoughts, perspectives on things, and I'm confident that over time, some direction, some initiatives, maybe some policy will come from one or more of those committees. I know the Paducah Sun is already kind of picking up a little bit on one of the items associated with neighborhood revitalization, that being bike traffic and that sort of thing. So that's good, because I think that's what we're interested in finding out, is what the interest is in the community and in changes or implementing new ideas or systems in various areas. So very positive about the direction that those committees are taking, with the input that was provided by the public through their participation in the citizen survey that was conducted almost a year ago now. Number of other activities going on, some programs being reviewed, everything from the small business incentive program to the dog muzzle ordinance that was brought forward here a few weeks ago. So a lot of things in the works at present. Couple of projects. We talked last week. In fact, the Commission approved the change order for the Riverfront Development Project. As it turns out, the contractor was on the job the next day, and essentially the work of replacement of some of the rock is essentially complete. The project as it stands today, is at the sort of punch list stage, pending final approval of the final contract payout to the contractor. So that all came together very good, and the contractor responded very quickly, and we're close to bringing that contract to a conclusion. The boat launch project is proceeding very well. Judging from the number of vehicles that I've seen make the trip down the hill towards the river as I'm going down the bike path, a lot of folks have taken the opportunity to check that out. It's an impressive project. It is not yet complete. It is nearing completion. I'm happy to say that it appears as though that is going to come in very, very close to budget, so we are happy about that. The mayor has mentioned the idea of having some kind of a celebration when that's ready to open up officially, so hopefully that's something we can do, hopefully before the weather breaks. If not, it's something we could certainly carry over towards spring if need be. That's all I have.
Okay. Mark, could you come up and talk about the Halloween coming up on Saturday, and talk a little bit about the garden clubs that are going to help out with some benches?
Oh, certainly. We have on Saturday at 1 o'clock at the dog park in Stuart Nelson Park, we will be having our first Halloween costume contest for canines. And so there will be 2 categories, big dog, small dog, just like our dog park is divided, and there will be first, second, and third places. We've got we've invited the animal shelter. They're supposed to be bringing some pets that for adoption possibly, and we're asking. There's no fee charge, but we're asking for donations of food for dogs and cats, and they are actually, I think, primarily requesting dried food, so that'll be easier for them to handle. So it should be a great day there.
Now, if some of the owners would like to dress up, they can also. That
may enhance their dogs' chances for victory, from what I understand.
I'll try not to let that influence.
In discussion with the judge, mayor, that may influence her in some form or fashion. One of the other things, and the mayor had recognized, in fact, we're working on it, starting on it now, Garden Club, and I'm trying to remember which, all the garden clubs blend with me, but they've donated $500 for benches in the dog park. And we're taking that money, instead of going out and purchasing benches, we're going to do that in-house, and we're going to custom make some benches and put them around the trees, a whole circle. So it's a great place for folks to gather, and we're going to try to stretch that $500 as far as we can.
I really like that idea when Mark told me of having the benches in a circle around the trees.
It's one of those great, late fall, winter projects that my guys can work on, indoors when they need to. And we're working on those and some others along the way. One other thing I think we need to make sure that we mention is the
Farmers Market Festival.
Well, you've got the Farmers Market Festival also that's going on downtown on Saturday. And then we also have the Fountain Avenue Fall Festival, which starts at 5 o'clock, with their human costume contest starting at 6. So.
What time does the Farmers Market Festival start? Is that
9 o'clock.
Okay.
So we've got another, as I've said before, if you're bored in Paducah, it's your own fault.
And they're going to have an apple cider. They're going to have a press there to show how apple cider's made, and have apple cider for sampling.
Mm-hmm.
Next year, I'd love for us to have a hay bale maze for kids to play in. I didn't want to spring that on you.
Let's see. We've got 2 days, Pam.
Maybe next year, just kind of.
Maybe next year, see what we can do there.
Will there be a movie?
Yes, there is going to be a movie at Fountain Avenue, and at dark it'll come on, and that's when the festival ends, is when the movie's over.
Yeah,
and it's going to be Brave.
Excuse me.
The name of the movie is Brave.
The movie.
Oh, I thought you was telling me I needed to be brave.
Well, when it's dark and it's chilled to the bone, you got to be brave.
Yeah. I get it.
So thank you all very much. It ought to be another fantastic weekend in Paducah.
Thank you.
I just want to just quickly ask all the commissioners. I met with Brooks Brestol, and he's with the 66 Corridor Study Group, and he's assembling a community advisory group. And I told him that I would like to be on that group. They're going to meet 4 to 5 times. The first meeting is in Olin, Illinois. So if there's a time that I can't go, I just wanted to know. You all let me know if you could be available. I'd give you probably 2 weeks heads up on the time. But I think it's important for us to be part of that study, and that I-66 corridor would go from Paducah to 55, and they're still studying the route. And that's what this initial group is doing. Very preliminary. Okay, I appreciate that. And anyone else have any comments tonight?
I just wanted to, again, congratulate the employees of the city for what they allowed our medical guys to do when coming up with, having them something to go to our healthcare providers and present. And I would also like to encourage some type of wellness appreciation that could go on so the employees will know that they did that. And here's the interesting thing about it. Even with the chronic individuals, you guys were still able to do this. So that's in spite of. So when those individuals, as Mark and the Parks Department and Public Works makes this community more available, more active, that it all comes back around to their health, to wellness, and that's a good thing. So they really did a good job of allowing us to hold that line there, and I think that needs to be brought out, because if they didn't do that, then you couldn't come and make this presentation.
Okay, we have a citizen here tonight that would like to make some comments. Mr. Rayberg. Welcome.
Thank you, ma'am. This is a spur of the moment. As I was heading out to the mall, as I usually do in the late afternoon to walk, and I got caught in the evening traffic jam on Buckner Lane, where it tees into what I call the Murphy-Paxton Interstate. Other people call it Pecan. And that was brought up at one of these meetings a little bit over a year ago, I believe. And it was going to be looked at. They talked about a traffic light, which I don't believe is needed, and a three-way stop would probably do the job. And nothing's happened, and the traffic's getting worse. Everybody's finding that that's a good way to head out to the mall. Not only the mall, but off in the other direction, probably toward the country club area, because they miss the US 60 traffic, which is terrible, and they miss the 62 traffic, which at this time of day isn't too good, and they've got a bunch of lights on it where it goes over the interstate. And I'm just curious to know if the city plans to do anything about that, or because we're over in the west end of town, we're going to be ignored about it.
I do know that Rick has had a study done of the Pines Road, Buckner Lane, that intersection where we've had several accidents.
Well, that's a bad one too.
Right. So I know he has done a study there. Now the Pecan Drive, Buckner, we have talked about a traffic light. I don't know if we've done any studies.
I don't think we need a traffic light.
But I do.
It's a three-way stop, and the same on Pines Road. It's the people that are turning left, and the traffic is coming up the road heading left on both cases, and you can't get out, and it's too narrow in the area to put the double lane, especially where it goes under the interstate. But something needs to be done because it's getting worse. And I've seen times when on Buckner, the traffic is backed up toward downtown beyond Pines Road. And I've seen it even on the new light that's over there on James Sanders, where the traffic is, it looks like a mile, but it's halfway out there. Well, what's the name of that road that cuts off? But it's halfway back towards well, it's not that far, towards Buckner. A big backup I noticed the other night. And this is simple. Now, I realize that putting a three-way stop sign is a heck of a lot cheaper than an $80-something thousand traffic light. But city can put that in with a guy standing on the back of the pickup truck pounding it in. And I suggest you try it because I think people are getting a little bit irritated. All right? That's all I have to say. Thank you.
Thank you.
I do also use that intersection a lot, and I do see that. I think it would be worth it. We should study what direction we should take with that, especially with Murray State opening up there with that new center. That could cause more traffic in that area. So
okay, I'll call the the traffic committee together and study that and bring a recommendation forward.
A quick aside: don't study it to death, which is done too many times. Remember, it's been over a year.
Mr. Rayberg, I also think they're working on a plan from Lone Oak Road over to Olivet Church Road. So I think once that road gets finished, that's going to relieve a lot of those folks that are coming that way too.
Yeah, but
to get to the mall.
I don't see that many coming over the hill usually.
Yeah. But I think that will help some. So.
Freeway stop.
Yeah. Right. We don't have an executive session tonight, so meeting's adjourned.
We meet.